Welcome everyone to our webinar today on So a Patient Left You a Bad Review, Now What? My name is Melanie Fielder and I'm a Senior Marketing Programs Manager here at Reputation, and I will be your host today. I would like to introduce you to your presenters, Celine Patterson and Clarissa DiCarlo. Celine is Reputation's Healthcare Strategy and Consulting Manager, and Clarissa is a Customer Success Manager here at Reputation. What is unique about these two is they are both former clients of Reputation. Both have launched and led online reputation programs at their respective previous organizations. They've been in your shoes and they understand the challenges of healthcare. Celine, I'll let you take it from here.
Thank you, Melanie. So at Reputation, we're built on the idea that you no longer have control over your brand. Your customers do. And that's because they're giving feedback anywhere and everywhere, whether you ask for it or not. And there are risks to not managing this feedback. In fact, 22% of prospects go elsewhere after reading one negative review. So basically, your consumers are reading reviews, and if there are more negative than positive, they're going to look to your competition. Another trend we're seeing is there's an expectation from our customers that brands will respond after they provide feedback, whether that's on your social channels, your public reviews, you name it. But if you handle that right, you can turn a negative customer into a brand advocate. And this impacts your bottom line. Gartner has stated that a 2% increase in customer retention can have the same impact as decreasing costs by 10%. So today, Clarissa and I are going to discuss some best practices for monitoring and managing all of this feedback in the healthcare space, where our patients are going for this feedback when making their care decisions, and important factors to consider when implementing a reputation management program. So, Clarissa, you want to take it away?
Absolutely. Thank you, Celine. So a few months ago, we released our 2021 Healthcare Reputation Report, which helped us understand not only what consumers want, but also how they're choosing a healthcare provider. Within this report, our consumer study with YouGov found that the vast majority of healthcare consumers trust online reviews, specifically 80%. And I think that may not be surprising to most people in the healthcare industry, right? We know that selecting a healthcare provider is a very important decision, and patients really want and need somebody they can trust. That additional feedback helps patients make informed decisions about the health of their health and the health of their family. In fact, after insurance and location, third-party reviews are the most important factor for consumers when choosing healthcare, with Google being the preferred review site. And lastly, healthcare consumers want to choose a doctor that's rated 4 stars or higher. So one quick important note, we're talking about reviews in today's webinar. However, don't forget, you'll need to make sure to claim and manage your business listings online so you have visibility into what reviews you're getting, but also the ability to respond to those reviews. And that's something Reputation can help with. So within this same report, we included a reputation score analysis that looked at 25 largest health systems and ranked the top 15 leaders in online reputation and experience. If you're not familiar with our reputation score, it basically provides a wide-ranging and complete analysis of both structured and unstructured feedback. And it takes into factors such as review value, response rate, and sentiment. When we examined the reputation scores of the leaders versus the laggards for patterns and performance, we found that leaders outperform laggards in all sections of sentiment, visibility, and engagement. Positive reviews and the quantity of reviews are important factors. However, today, our focus is specifically on engagement. Leaders who do a great job with online reputation management are engaging more with their customers and responding to more reviews, specifically 57% more. So before we get into the nitty-gritty of the best practices of managing all of this online feedback, we'd like to get a better understanding of where our audience stands with responding to and engaging with reviews. So please take a moment to answer this poll question. Are you currently responding to reviews? Yes or no? Don't be shy.
So we'll give everyone a couple of moments to answer. A few more seconds here. Okay, I think that's good. So now that we know a little bit more about what our audience is doing when it comes to responding to reviews, we're going to talk more about the nuances and the complexities that other industries such as retail or hospitality might not be confronted with. So when Clarissa and I first met, we spoke a lot about our experience with previous roles and the considerations that we had to keep in mind when we started managing reviews and building out our respective reputation management programs. So for me, the most challenging part was getting everyone on board. So Clarissa, who all did you need to get buy-in from before you started responding to reviews?
Lots of different departments. So the most important part about stakeholder alignment is to get everybody involved early in your online reputation management program. To be successful, you're really going to need to partner with all of these groups, and this will really benefit you and the success of your program in the long run. Some departments you'll want to consider are, of course, the marketing and communications department, patient experience. Patient experience is such an important department to partner with. They'll be able to assist with service recovery and patient experience improvements that come as a result of all of this review data you're getting. Of course, your executive team, having your executive team bought into and supporting your initiative always helps you downstream when you're working directly with operational leaders, providers, practice managers, things of that sort. And last, but maybe most importantly, is your legal and compliance department. Now, Celine, you had a great working relationship with your legal department in your previous role. Would you like to share more about that consideration?
Yeah, absolutely. So first and foremost, the most common concern I faced, and understandably so, was ensuring we were compliant with regulations. So for example, HIPAA and PHI, making sure we did not confirm someone was a patient or that we didn't disclose any information that was not already within the review itself. And, if the review is made by a loved one, which often it is, ensuring they are aware that due to federal privacy laws, we can't speak with them regarding their loved one's care, but encourage them to have their loved one follow up with us directly. And with all of this in mind, while we were responding, we always said that we didn't want to over-engage, that our goal was to take the conversation offline. And this applies to employees as well, making sure that they're aware of our media, social media, employee policies, and that as an organization, you adhere to those as well when speaking to or about your employees online. And, while we speak a lot about the negative feedback, when it comes to positive feedback, make sure you ask for consent whenever you choose to use online feedback for testimonial and or marketing purposes, regardless if there is patient identifying information or not. Keep in mind, this is a Google specific policy within their guidelines. And lastly, when crafting your responses, create a do not say list. See what your legal team is and is not comfortable with you including within your response. I strongly recommend clearing all public responses by them to ensure that they adhere to your specific organization's policies, mission, etc. So Clarissa, we all know what we say is important, but what about how we say it?
Right. So how we say it is equally important, especially since tone is harder to convey online than when you're speaking with a patient in person. So first and foremost, make sure you have consistent messaging that aligns with your brand. It's a great idea to have a list of several positive, neutral, and negative responses, and make sure to vet, as Celine mentioned, that list through patient experience, marketing, legal, and communications. This will ensure you have pre-approved responses and are able to quickly respond to reviews at scale. With all industries, but especially with healthcare, you want to make sure your language is inclusive. And lastly, make sure your tone reflects the comments. For example, if you got a very cheerful post, you should give a very friendly response. On the other hand, a very negative or serious comment should be met with acknowledgement of the seriousness of the post. Always make sure to demonstrate compassion in your response. So now that we've covered important considerations, Celine's going to jump into some different types of feedback, and then we're going to cover some best practices.
So very often we hear from clients that their leadership is concerned with the type of feedback that they receive, assuming that a lot of it is clinical. But very, very often this feedback is not clinical at all, right? It's not were they happy with their appendix removal, but how was the ease of scheduling? Was it easy to find parking? How friendly was the front desk staff? Were the bathrooms clean and so forth? So this is what I like to call the low-hanging fruit of complaints, the things that you can fix now and quickly. So what you see on the screen is just a very small sampling of the type of feedback you may encounter online, which is why it's so important to get all the parties Clarissa mentioned previously involved, from your operational leadership, your patient experience, your clinical leaders, etc. And the beauty of online feedback is being able to track all of it in real time and identify trends which you can action on, something we're going to discuss in detail during our upcoming webinar in October, so stay tuned. So we now know that responding to reviews is crucial and what considerations to keep in mind when doing so. But Clarissa and I really wanted to dig even deeper into a few best practices. The first being determining ownership. So who's going to manage all of these online reviews and provide that initial service recovery? Is this going to sit with your marketing team, your patient experience team? But regardless of who owns this initiative, it's crucial that it's all in collaboration with one another. And do you even have the resources to build out an internal team, right, to handle all this online feedback and escalate it? Or are you stretched thin on bandwidth and interested in utilizing a solution such as Reputation's managed services for review response to take it off of your plate? So in previous roles, I've experienced with both fitting our needs in various ways. But once you determine that ownership, make sure you establish a review response protocol, so your workflow. So if it's positive, you thank the reviewer naturally, right? Now, if it's negative, is it a detractor? Is it a troll? Is it a loved one, a patient, a generic question, or spam? All of these scenarios should be routed differently, and determine that route. Positive goes to local marketing. Maybe it goes to your clinical leadership for internal acknowledgement. Your negative clinical, that goes to patient experience. Maybe your negative non-clinical goes to administrative staff. All of this should be personalized to your organization and how you work, with the overall goal of ensuring you provide closed loop service recovery, regardless of the type of feedback. And if all of this sounds cumbersome, which it may, and I'm sure it does, Reputation has many solutions that can help you create task-oriented queues and seamlessly automate this process. So all of this is great, but only if you know what to say, right, Clarissa?
Absolutely. So we've already talked about those very important pre-scripted responses. Of course, we want to make sure that we're not using the same responses over and over. So make sure you have a wide range of responses. But it's important to have that list of responses and that they're vetted and they can be slightly tweaked handy. As Celine mentioned, a do not say list is always helpful. For example, I know a lot of clients prefer not to use the term "I'm sorry" in a response, or to make sure not to use the patient's name in a review response. Having this important do not say list will help to ensure you stay within your brand guidelines and also far away from any compliance or legal issues. And our healthcare team can help you with crafting these responses. So Celine, once we know what to say, how do we know when to engage, when to say it?
Great question. So as mentioned within the workflow, there will be times that you don't want to engage. So this is something we talk a lot with our clients about. In my previous role, we strive to respond to 100% of reviews, but there was a small percentage that we didn't respond to. So this is really where you need to do a gut check, right? Does the review sound strange? Does it sound like they've already reached out to us multiple times? Do you think there's more to the story? So for those type of reviews, it could be very well that the patient experience team is aware of the individual and they actually don't want you to further engage, or there are some legal concerns behind the scenes. So maybe someone is even just spamming you, right, because of a potential negative news story. So use your best judgment for these exceptions. But in my previous role, when we engaged, also tied to some of our internal goals. So Clarissa, what's your advice for setting standards?
Yeah, I'm a huge fan for setting standards and setting goals. So, it's a great idea to do this organizationally or departmentally, or even just a personal goal if it falls into your role at your organization around review, responding, and management. A couple of common examples include setting a time threshold for responding. So for example, at my previous organization, we had a goal to respond to all negative reviews within 24 hours, except for those very few examples that Celine mentioned where you create an exception. Often clients have a goal around responding to a specific percentage of reviews. For example, agree to respond to 100% of negative and 50% of positive reviews. Lastly, when resources are low, which I know is often the case in healthcare marketing departments, I know, clients will make sure to focus their responding efforts on certain platforms. So, for example, from earlier in the presentation, we know that Google is the dominator in the field. So, set a goal to respond to 100% of Google reviews within 24 hours. Setting goals will help keep everybody on track. Celine's going to jump into another very, very important area that will help our clients remain proactive and not reactive.
So, Clarissa, I love shifting this mindset to be more proactive and less reactive because in the end, it made my job easier. And all of that is about having pre-approved statements for various, let's call them, crisis situations. For example, so previously I managed ORM for many hospitals in the Southeast that were prone to hurricanes or facilities in the Midwest that experience a lot of tornadoes. And being prepared for the resulting power outages, the restricted access to those hospitals or those facilities or providers, employee questions, et cetera. Having a plan was crucial, and this cut down the amount of time it took internally to scramble and come up with appropriate PR approved responses. So other scenarios such as negative PR stories, political and or societal ongoings, lockdowns due to a potential outside threat, those are just a few other scenarios to consider. But let's not be fearful. Not all feedback is negative and not all situations are going to be scary. So Clarissa, between our clients and your previous experience, what have you seen organizations do with some of the positive feedback?
Yeah, so first, always make sure to try to remember to find time to share positive feedback internally. When you're dealing with patient feedback in your role, I know from experience that it can be kind of a downer sometimes because so much attention and energy, and rightfully so, is given to the negative reviews. And oftentimes little is given to the positive feedback. And there's usually so much more positive feedback. We'll get into requesting reviews in a later presentation. However, this will be much more evident if and when your organization adopts a review requesting strategy. There will not be a shortage of positive feedback to share with your teams. There are just so many ways to do this, right? Simply forwarding the review on is one easy way. But we have clients that have formal star programs. They share during rounding, internal message boards. At my previous organization, we did these fun little videos we called sweet tweets and mimic them after Jimmy Kimmel's mean tweets, where we would have providers read their positive online reviews, thank their patients on camera for leaving that feedback, and then we shared those little videos with our staff and our community.
I love that idea. I think that's an awesome way to share such great work. But I hate to say it, but what if some of the feedback that we get about our employees is negative?
There will be a time, and I'm sure a lot of you have already experienced this, when you have reviews that mention employees by name or when an employee leaves a negative review on one of your online review sites. So just a few important things to consider. Stay away from confirming if somebody is an employee with your organization. If there's a negative review and it mentions the employee by name, just simply thank them for bringing it to your attention and maybe add a line or two about your organization's ethics and values. Share that information to internal teams that need to hear the comment so that they may address. In the case of employees who leave a negative review or chime in on a negative review, make sure you have a really strong social media policy in place at your organization and follow that. If employees choose to list their place of employment on their social media accounts, they really need to understand that they are brand advocates and what they do or say can be tied back to the brand. So that about covers some of the best practices when implementing a reputation management program.
Awesome, Celine and Clarissa, such a great job. If you enjoyed our session today, please register for our next installment in the series. We'll jump to the next slide. The what, why, and how of requesting reviews from patients. This webinar will take place on September 9th at 2 p.m. Eastern, and I'll share the registration link in the chat momentarily. Further out, save the date for the final installment of this series, how to turn online patient feedback into actionable insights. This webinar will take place on October 14th, also at 2 p.m. Eastern, and I will also drop this registration link in the chat. In the meantime, moving on to Q&A. So, Celine and Clarissa, either one of you can take this one. How can organizations get legal on board with review requesting when they cite TCPA and HIPAA as reasons why we can't request reviews?
Yeah, so I'll take this one, Clarissa. So understandably, right, especially in healthcare, legal teams are going to be concerned. They want to make sure that we are not exposing any PHI, that we are compliant. Keep in mind, all of this feedback that we're seeing is on our third-party site. So it's out there in the wild. We're not necessarily disclosing any of this information. The reviewer is. So again, this goes back to your internal policies and what your legal team is comfortable with doing. For example, previously in my role, we were okay with using the reviewer's name and acknowledging a name. We just made sure that we omitted certain words, such as what Clarissa mentioned, the word sorry, because we didn't want that to come up in court litigation down the road. In terms of other responses, just again, make a do not say list. Make sure that you have those brand guidelines for training purposes as well if you add on to your team, so that your team is well aware of what you do and do not want to say in those responses ahead of time. That is a great question. I see some others popping in as well.
Yeah, they're coming in quickly now. How about this? Should you respond to every single negative review, or will there be times when it's best not to reply? What are the risks of replying or not replying?
Yeah, so, as Clarissa mentioned, we want to respond to 100% of reviews in a best case scenario. In terms of the reviews that you don't want to engage with, as mentioned, there's going to be a couple of exceptions. For example, if there's one that just doesn't sound right, or if they say, you killed my loved one, those type of reviews, those are the ones where we might want to take that internally, see if there's anything on the back end that we're just not aware of before we decide to publicly engage. Also, keep in mind the risks to not responding to your negative feedback, what that says to all of your potential patients that are reading those reviews when they're making their healthcare decisions. So not only is this about service recovery with that individual patient, it's also about making sure that prospective patients see that we're listening to this feedback and that we care about being a part of that dialogue. That's an awesome question.
So piggybacking on that, how should someone handle a negative review when it's unclear if the reviewer is a patient? The reviewer is using a name that can't be identified.
That's a great question as well. So a lot of times, on these social media channels, people use alias names. For example, I have a Facebook page that actually is the name of my dog. It's not my name. So if I were to leave a review, people wouldn't know that it's coming from me. So that's where you work with your risk teams to ensure that you're doing that back end work, right? So you're providing that initial service recovery to that individual. You're taking that conversation offline by encouraging them to either go to a contact us form, a private message, etc., so that you can gather more personal information from them, such as their legal name, their contact information, etc. Regardless, you're going to send that negative review to your local teams to check into that, see what's happening on the back end. Is there any more information where they can reach out proactively and provide that service recovery? Clarissa, is there anything you wanted to add to that?
No, I think you basically covered it, Celine. That was great.
Next one. What advice do you have for ex-employees who leave negative reviews?
Clarissa, you want to take this one?
Sure. So, what you want to do, with most negative reviews, is try to take that conversation offline. So you don't want to get into, if this is a patient review or an employee review, you don't want to get into, a kind of tit for tat anywhere online. So attempt to take that conversation offline. If the ex-employee did have a visit at one of your facilities and they have a legitimate complaint, they just happen to be an ex-employee, well, then treat that complaint or negative review just as if they're a patient and respond to that review and ask for them to reach out to you to learn more. If it's an ex-employee that might be leaving a negative review on, let's say, Indeed or Glassdoor or one of those employee-related review sites, again, the same kind of standards apply. You're going to want to take that conversation offline, acknowledge that they left a review, and ask them to reach out to you because you want to learn more about that review or more about their situation. Celine, do you have anything to add on that one?
Yeah. So one thing too, just to keep in mind, certain platforms such as Google or Facebook, right, their branding guidelines actually don't allow for employees to leave any type of feedback on those sites. So that might be an opportunity to flag that review for potential removal. Keep in mind, it's very rare that review might get taken down, but that is something that you could potentially do as well. Great question.
Have you seen a difference in the impact on and therefore strategy for online consumer reputations for more retail style healthcare, like primary or urgent, compared to more specialty or referral based services like cancer or cardiology?
Yeah, so I'm actually just reading this question just so I make sure I understand it a little bit more. But yes, I mean, this is a big thing about healthcare consumerization, right? It's very similar, and I hate to say it this way because healthcare is so personal and it's so intimate. But the journey of selecting your healthcare, it very closely mimics such as those other industries, right? Hospitality, retail, when we go shopping on Amazon for, whether that be laundry detergent or a pair of shoes or whatever it may be, healthcare is going very similarly down that path in terms of a symptomatic search. They're not necessarily going to search your facility or your provider. They're going to say, broken ankle symptoms or something. And then we just want to make sure that we optimize your Google presence with a lot of this review management, right? To make sure that you are appearing first in that search when they're doing those symptomatic searches. So yes, healthcare is definitely going down that route when it comes to consumer expectations.
Awesome. Is it a good idea to reach out over the phone in addition to responding to a review, or only encouraging them to reach out to us?
That's an awesome question. I think it's really going to depend on your own organization. In a previous role, we really did both. So we made sure that we encouraged them to reach out. However, if our local teams had that individual's information, if there was more to the story on the back end, they've already been in communication with this individual, they would proactively reach out as well. So it just goes to show you're listening to that feedback. And at the end of the day, you just want to provide that service recovery, no matter how you decide to do that.
Yeah, and I'd like to jump in here as well, Celine. So it is up to your individual organizations, but like Celine, we also, depending on the review, would reach out to the patient to do that service recovery if we were able to identify which patient was. And I can just tell from experience that makes a big difference to a patient to know that you're listening to that review, that you're not only responding to it, but you're actually taking action on that comment or acknowledging that patient, or perhaps you've taken action and you're calling them to let them know what steps you've taken and that issue is now resolved. They do really appreciate that feedback. So again, it's on a case-by-case basis depending on the review and your organization, but typically patients have been very responsive and appreciative of that outreach.
Fantastic. We have several more. All right. Someone did ask if you wouldn't mind repeating on that question about Google guidelines on previous employees. If you want to jump back to that really quickly, Celine.
Yeah, so I just recommend just doing a quick, no pun intended, Google search on Google's branding guidelines, specifically for review policies. And you can see right there, they update that quite frequently, where they will have certain things that violate their terms and their policies, specifically feedback that's directly from employees. So I definitely recommend checking that out.
Wonderful. Knowing that doctors really appreciate objective data, what resources and studies are available to help them help educate them about online reputation?
I love that somebody asked this. As Clarissa mentioned, we did release our reputation report for 2021 earlier this year. And in that report, there's a lot of awesome nuggets that really drives home the importance of online reputation, especially for physicians. So definitely go to our website, check that out, download a copy of it because there's going to be some great data in there.
Yeah, and I just like to second what Celine said. The healthcare reputation report is amazing, but the more information and the more data and the more materials you can provide your providers, the better they feel about kind of launching and participating in any kind of initiative to request reviews, respond to reviews, things of that sort. So you're always going to have those providers that are like, yes, 100%. I want my Google knowledge panel to have 80 positive reviews. I want everybody to know how great I am. But then you're also going to have those providers that are a little bit hesitant, like they're worried about any potential negative reviews that might come, or they're concerned with reaching out to their patients and asking their patients for feedback. So the more information and data you can provide, those providers, the easier it is to get, that stakeholder alignment that we're talking about, more of them involved in the initiative and into the program, and buy-in from those providers.
Fantastic. Is it ever appropriate to ask a patient to change or amend their review?
Oof, this gets a little sticky. It's a little bit of a gray area. Again, this is really going to be a case-by-case basis. It's not a one-size-fits-all. In my previous role, we did not do that. We ethically didn't think that that was correct. We in no way wanted to influence someone's organic feedback because, hopefully they come back and they have a great experience, but what if they don't? And what if something turns wrong down the road? And then all of a sudden it's like, oh, well, this organization actually asked me to change my review. So just be careful with how you choose to go about that.
Yeah, I second that 100%, Celine. We never went and asked patients to change their online review either. But I will say that we've had patients go out there themselves after we've done service recovery and reached out to the patient or responded and let them know what issues were resolved and gone back and changed their feedback or left another review that reflected a positive sentiment after that. So we've had patients do it without us soliciting, but we've never went out and asked them to do that either.
Another great question. Where can we find this reputation report?
That's great. I'm going to make sure that we drop the link in the announcement. So check there for the specific link. But if you just, search reputation.com 2021 healthcare report, you'll easily find it. I know we probably have time for maybe one more.
Yes, we do. Should we reply to bad reviews at all instead of getting it removed?
Love this question. So you cannot remove reviews. It is not a functionality of review sites. Imagine if it was, right? How many restaurants out there would just have 5 stars? How many hospitals would have 5 stars? So it's just not an option. We can't get it removed unless, as mentioned earlier, it violates the brand guidelines, policies, in terms of the platforms such as Google or Facebook. And again, keep in mind, just because you report a review doesn't necessarily guarantee that it's going to get removed. I've actually had a lot of instances where those reviews don't get removed. It's best case scenario, right? So yes, reply to your bad reviews. It shows that you have compassion. It shows that you care, and it shows that you're listening to that feedback that you're getting online, because that's vital to improving the service that you provide and the care that you provide to your patients.
Right. And it's not always bad that you have, a handful of not so great reviews on there. I mean, nobody's perfect. No provider's perfect. No facility's perfect. Mistakes happen. And so like Celine said, it's just great that when you have those negative reviews, you acknowledge them, you do the service recovery, you let your patients know that you've handled that situation, and that you're listening to them when they leave these reviews. So it's okay to have a negative review. It's just most important to make sure that you take that review and drive change and make change within your organization based on that negative feedback.
And final question for you guys. What is the best method for requesting a review?
Text, SMS, 100%. That's going to have a higher completion rate. It's going to have a higher open rate. Ease of use, think about your day-to-day, right? You're always on your mobile device, and you're more likely to actually leave that feedback. Now, if you have strict policies about SMS, like I have encountered in previous roles, where your legal department just might not be as comfortable with SMS because of the different laws and regulations with communicating with your patient. So if that's the case, start with email, default to email. Email is a great option as well. Again, it can go to a mobile device. It is through technology, so we're not sending anything physical, but if you can, start with SMS.
Wonderful. Thank you again, Celine and Clarissa, and thank you everybody for tuning in today. We hope you learned something. We will see you next time.
Thank you.
Thank you all.